is the news at 10.
Good evening and thanks for joining us here on the news at 10. To say we're in a healthcare crisis wouldn't be an understatement, and it wouldn't be the first time we've said it. After all, we just got out of a 3-month stretch of Idaho hospitals operating under crisis standards of care, and we could be back there soon. Treasure Valley Hospital's already said as much last week. Primary Health Medical Group just wrapped up a weekend when they closed 7 clinics because of COVID and a lack of staff. They are seeing a positivity rate at primary health clinics of 50%. And the crisis level isn't isolated to primary care in Boise, but at clinics and some hospitals throughout Idaho. In rural areas, Katya caught up with some of those who are facing even more challenges. Katya?
Well, Brian, that's absolutely right. Some of these rural clinics and hospitals are also seeing record-breaking positivity levels and that demand for care, but the added pressure on them, even more limited resources.
We just saw a sudden, very rapid uptick in cases, which we've attributed to the arrival of Omicron to the community. And it's been taxing all systems.
Kelly McGrath, the chief medical officer at Clearwater Valley and St. Mary's in Orofino, says positivity rates are running anywhere from 25 to 40% in the last week, and wait times for care are growing.
You know, our staff who have been taking precautions all along, we're seeing more of them be infected now, where previously they were successful in staying well.
He says the added challenge of being in a rural clinic is not being able to transfer patients to large surrounding hospitals for critical care services.
I had a patient with a large gastrointestinal hemorrhage that needed critical care, and we're not able to transfer that patient. Another patient with a critical neurologic condition that had to be put on a ventilator and ultimately was transferred to Portland because there wasn't capacity within our state for that patient.
How long are these wait lists for some of these patients?
Some critical cases we've had to wait 14 to 20 hours before we've been able to then move them on.
Over at Salmon River Clinic in Stanley, with only a total of 3 staff members, Amy Klinger fears for what could be on the horizon.
So my biggest concern is people postponing their routine care or care for illness and injury that can, get worse over time in light of the pandemics.
To avoid ridding of resources entirely and falling back into crisis standards of care, health experts say the time to get vaccinated and boosted is now.
Returning to that level of crisis in our hospitals and in the care that we're giving is really devastating to us in the community. It's demoralizing because it's what we try to avoid. It's why we do what we do.
Our concern is that this is going to just continue to increase. And then the rural areas themselves, I think, although we're keeping our head above water right now, continued staff shortage and increasing demand beyond where we are right now, it's going to be a challenging time.
Yeah, unfortunately, that's what it looks to be. And an update I want to mention to our viewers, Orofino's positivity rate is at 35.2% as of today and just continues to rise, filling up clinics and hospitals once again. Brian.
And that boosted shot is what is important, because if you've been vaccinated, like say 6 months ago, it's not showing that it's been very good against this Omicron variant. So that part is important. Thank you very much, Katya.